Hello everyone, I'm Katie, a general practitioner from Hong Kong. I've been working in the aesthetic industry for 10 years. May I introduce Hong Kong, such a beautiful cosmopolitan city. Here, I have grown up, studied, and started my career all along. As you can all appreciate, 2020 has been a bad COVID-19 pandemic year, both globally and here in Hong Kong. COVID-19 refers to a cluster of viral pneumonia, first discovered to occur in Wuhan, China since December 2019. A novel coronavirus was found to be the causative agent. The main mode of transmission is airborne or through contact. According to the World Health Organization, members of the public should maintain good personal hygiene at all times. In particular, wearing of surgical masks has become mandatory in most parts of the world, since it has proved to prevent transmission of the respiratory virus. When we take off our patient's mask, we discover that their skin is being affected from months of being covered. Irritated skin, acne outbreaks, and many new skin problems. This comes into a phenomena which we call maskne, a skin condition caused by mask wearing. Mind you, this is nothing new. It has been around for years globally in medical personnel and in some parts of Asia as a protective measure against high levels of pollution. Surgical face masks are occlusive and designed to block very small particles. So when we breathe into the mask, we create a hot and damp microenvironment. High humidity and hot temperatures have been correlated with acne flare-ups. It was found that sebum excretion increases by 10% for each 1 degree Celsius rise. Studies have also found that high ambient humidity precipitates acne due to poral occlusion on skin hydration and irritation to the upper parts of the pilosebaceous stud. In addition, sweat and increased humidity might cause swelling of the epidermal keratinocytes, thus affecting the keratinocytes of the pilosebaceous follicle, causing acute obstruction and acne aggravation. Repetitive rubbing from wearing and removing a mask causes the stratum corneum to peel off, destroying skin barrier function. Also promotes moisture transpiration, making the skin sensitive. This also explains why acne is not the only skincare problem caused by wearing a mask. Other potential skincare problems such as contact allergic dermatitis, seborrheic dermatitis, rosacea, and folliculitis are caused by prolonged hours of wearing a mask, which leads to dry, itchy skin from skin occlusion. Stress and anxiety is very abundant during COVID-19 pandemic, which is well known to trigger off acne outbreaks. During stress, cortisol is released, including in glands near the skin hair follicles inside the pilosebaceous duct, escalating the production of sebum, which is a favorable environment for Propionibacterium acnes bacteria to initiate an immune response. Prevention is always better than cure. It is easier than you might think. Actions speak louder than words. So here are some tips below. Use a hypoallergic mask, especially if you already suffer from skin issues. Wash your face and use a moisturizer before putting on a mask and after taking it off. Not only will this keep your skin hydrated, it also acts as a barrier between your face and mask, thus reducing friction. Reparative creams or zinc oxide can also be applied if friction persists, as this forms a barrier to help reduce irritation and inflammation. Avoid makeup. Make sure the mask is not too tight, yet sits closely and seals. Replace and break off 15 minutes every 4 hours, but replace immediately after meals and exercise. In general, it is best to avoid new skincare products and chemicals which can irritate your skin, like benzoyl peroxide, retinols, salicylic acid. This unique pandemic-related era forces us to come up with mostly non-invasive, painless treatments with no downtime, catered to our patients' needs. My favorite approach is combination therapy. My aim is not only to kill Propionibacterium acnes bacteria, but also to promote skin barrier function, prevent acne-related hyperpigmentation, scarring, and above all, to promote skin health, which is equivalent to building up our body immune system holistically. This skin pyramid is the most ideal for our daily skincare regime. Hydrofacial treatment involves 3 steps in 30 minutes and delivers instant results. Step 1. Cleanse and peel using a combination of glycolic acid and salicylic acid of different concentrations. Step 2. Extract and hydrate. Remove debris from pores with painless suction. Nourish with intense moisturizers and boosters that quench the skin. Step 3. Fuse and protect. Saturate the skin surface with antioxidants and peptides to maximize the glow on it. It is also suitable for all skin types, all ages, genders, and ethnics. Lip Revitalizing Serum gently exfoliates, lightly plumps, and boosts lip hydration. Eye Replenishing Serum brightens and hydrates the delicate eye area. For even deeper transdermal effects, another device, dermal electroporation, has been FDA approved for local administration of ionic drug solutions into the body for medical purposes. And it can also be used as an alternative to injections. Dermal electroporation increases skin permeability via water-based channels and allows nutrients, skin products, to be absorbed deep into the hypodermis and muscle membranes. This penetration is faster and deemed impossible with traditional anthophoresis. Micro and macromolecules, such as hyaluronic acid, vitamins, amino acids, anti-inflammatories, can be safely delivered into the body without either modification of the ionic drop pH nor electrolysis effect of the ionic solution itself. Our busy daily activities of living induces stress, dysregulates our hormones, weakens our immune system, and refrains us from proper daily skincare regime, thus intensifies and aggravates our pre-existing skin problems. Further skin transformation with just a single treatment for a faster, more long-lasting effect is required. Hyaluronic acid, preferably with 5-course technology, is the choice. It can be injected directly within the dermis. The high water binding capacity of hyaluronic acid combines with water in the skin to improve hydration, elasticity, and skin smoothness. It also displays better resistance to free radicals than other injectable products, reducing the degradation of hyaluronic acid. It can be widely used to treat the face, neck, and hands. We will start the injection treatment now with a 36-year-old patient with no history of any skin hydrating treatment. This is a 1 ml syringe of folate. Enclosed with this is a 32-gauge half-inch needle. I usually use this for all my treatments, including the face, lips, neck, and hands. So we'll start off with cleaning the skin. Stretch the skin and insert the needle about 30 degrees obliquely to the skin. So we usually start over the lateral part of the face for the following reasons. Because this is a relatively nerve-free region, the patient will feel less pain. Secondly, if anything happens, then it's only over the lateral part of the face, and for these reactions, it will not be so prominent over the other parts of the face. We'll start the injection over her lips. Then again, we'll start with stretching up of the skin and inserting the needle obliquely to the skin and about 30 degrees. Again, about 1 centimeters interval. I would usually inject following the lip lines to ensure that the driest part of the lip has enough hydration. Now we will proceed with injection over the neck. We will inject over the neckline like a bead to inject over the dermal layer across the line of the neck. For injection of the hands, again, we would inject over the lines of the hand. Especially over the knuckle region, we need to inject droplet by droplet, slowly with the least amount of pressure. Eyes are the souls of humans. When all we can see are eyes, it's high time we defined eye beauty. Teardrops and related under eye shadow, causes typical tired look. Compounded with profound eye bags, severe skin sagging, periorbital signs are the most common and most significant to age a person by up to 10 or 5 years. But on the other hand, it's the most difficult part to treat. It is recommended to first inject Botox, botulinum toxin, to relax the group of periorbital muscles. Then use hyaluronic acid to restore smoothness, enhance contour of the entire face, and above all, helps regain self-confidence. Tips is to lift the mid-face for good support. Then create and perfect eye contouring by augmenting periorbital volume loss, smoothing out the lateral eye area and depressed wrinkles. Good luck, everyone! Let's really hope the pandemic situation will improve soon. Till we next meet, maybe in Hong Kong. Bye!